Next illustrated is the mechanism of severe and constant pain in clinically significant cases of adhesive arachnoiditis. Normally, pain impulses travel to the brain by way of the dorsal root ganglia of the spinal nerve. Nociceptive impulses pass from the dorsal root ganglion up the spinal pathways to the brain itself, where pain is appreciated. When a normal dorsal root ganglia is stimulated, as shown here in a laboratory setting where a pig hair is being used, the stimulation of a normal dorsal root ganglion results in a short, quick pain impulse which is self-limited. The situation is very different if the inflamed dorsal root ganglion is stimulated in a similar manner. There is not a short, self-limited impulse, but continued, long nociception constantly being produced by the dorsal root ganglion to the brain. Inflamed dorsal root ganglia are so hypersensitive that even body movements, such as breathing, can elicit a continuing train of impulses to the brain. We will now observe actual operative photographs of the various stages of adhesive arachnoiditis. The view of the first stage shows the nerves to be swollen, obliterating the spinal fluid within the dural sac. The second stage shows progression of scar with the nerves adherent to each other and to the dura, and the third phase shows such severe scarring that opening up the dura appears to be an empty cavity because of the extensive scarring. If the scar tissue begins to calcify, it can produce a condition shown here, calcific arachnoiditis, which can produce progressive squeezing of the nerves leading to impairment of bowel or bladder function. Although adhesive arachnoiditis can be produced by exposure to different toxic agents, there is no question but that over the past 50 years throughout the world, the primary cause of clinically significant adhesive arachnoiditis has been the presence of iofendalate in the subarachnoid space as a means of diagnostic myelography. Any invasive myelogram is capable of producing serious complications of some sort. Iofendalate, however, has been unique in this regard over the years. The disease-produced adhesive arachnoiditis can be a very cruel disease. This has been and continues to be a worldwide problem. This entity has been a difficult process to understand. Thank you.